So let's begin. Time is already 8 o'clock as per Mauritius and 9:30 as per India. So welcome dear participants. Welcome to this webinar we have today on behavior in children with autism. So
Yes.
I can see the group because with the registrations I can see that this is a mixed group of parents, caregivers, and professionals around the world joining us today. So let us work together to understand behavior, not as a problem, but as a form of communication. So today we are going to understand how behavior can be a communication, not a problem. I am Dr. Alok, clinical psychologist and autism expert. Have been practicing over 20 years now with children with autism and developmental disorders. Currently working as the director with JKP Care Foundation, and I'm an international trainer, consultant for autism intervention and parent coach. So about the organization which is running this webinar today, JKP Care Foundation. So JKP Care Foundation is a global mission for autism support. We are a non-profit organization working for autism awareness, training, and creating family support. I'm proud to share that we have trained over 4,000 professionals and parents worldwide. We offer specialized diplomas, online trainings, and therapy programs. And our motto is empowering families, transforming lives. So we work with professionals, we work with children, and we work with parents. All three, important domains of autism. So looking into the JKP projects that we look into, uh, apart like we run JKP Training Academy in which we run different training programs. Then we have Spandan, which is a residential rehabilitation center in Mumbai. I would request you to just put yourself on mute, please. Yeah, requesting everyone to kindly be on mute. Just one moment.
Yes, it's okay. Hello.
Yes, I'm just muting everyone. Yeah. So we have Spandan, which is a residential rehabilitation center in Mumbai, India. We also have an autism-free helpline where parents can call 24/7 and they can raise their concerns. They need some support, guidance, and we provide them free consultations. We have a beautiful product that is called Mothers Assist. This project is uh, basically to support the mothers of special need children, their own mental health and psychological support. Spandan Shore Heaven is inclusive eco retreat. It is a village resort project which is running in outskirts of Mumbai. And beautiful part of it is it's a village resort with eco living, but it's being managed by children and adults of Spandan Rehab Center. So people with autism and various neurodiversity together, they are managing the entire eco resort project. We also have center-assisted therapy and parent-assisted therapy programs. We do collaborations with centers, different pediatric rehab centers and schools. ABHMs is a other project through which we are running ABA therapy programs in our leadership with various schools and hospitals. And proud to share this Aspire e-Pathshala. We are just launching it tomorrow. Being an auspicious day tomorrow, we are launching Aspire e-Pathshala, that is an online school for children with autism. So this is all about the JKP projects. Now let's get back to the introduction of the topic. So today's topic, as I have told you already, is behavior. And we are going to look at behavior not as a problem, but as a communication. So behavior in children with autism. Every behavior has a reason and purpose. So remember, if a child is doing a behavior, be it a good behavior, what you call is acceptable, or be it a negative behavior, which we say is not acceptable behavior. Every behavior is because of a reason, of a purpose, which we call as function of the behavior. Children with autism communicate through actions more than words. Understanding the why behind the behavior is the key to change. So this webinar, I will just first present you with few slides. I think I'll take first 30-35 minutes for this presentation. And post this presentation, we will have question answer session as well. So I'll give you as long as it is required, maybe 1 hour, 2 or 3 hours, as long as your questions are there, I'll continue with the session. But first 30-35 minutes, we will dive into the topic behavior as a communication. Before that, I request all of you just take a pause for a few moments, close your eyes and visualize your own child. If you are a parent, then your own child and his or her behaviors, which really bother you. Just try to memorize, try to bring them in front of you. And if you are a professional, so then consider any of the children who come to your therapy center or in your special school, and what kind of behaviors which actually bother to you. The behaviors which are troublesome, the behaviors which to whom you call tantrum or you call meltdowns. So I'll count from 0 to 10. I request all of you to sit still, close your eyes, and just visualize your child and his or her behaviors. Behaviors that bother you the most, behaviors that you want to change. So let's start. 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yes, you can open your eyes now. So I wanted you to bring all those behaviors in front. Keep them in front of you now because you have visualized them. They are in front of your eyes. Keep them in front of you. And let us start looking at those behaviors one by one. So as I said, behavior in children with autism, every behavior has a reason and purpose. Children with autism communicate through actions more than words, and these actions we call them as behaviors. Understanding the why behind the behaviors is the key to change. We all want to change some behaviors, the behaviors which you have thought right now about. We want to change them. And we keep on giving instructions to the child. Don't do this. This is not good. You are a bad boy. You are a bad girl. But still, we see the behaviors reoccurring again and again and again. So we need to understand why these behaviors are coming, what child is trying to communicate, what is the reason, what is the purpose, or what is the function of that behavior. So understanding behavior in children with autism is crucial for effective support, because when we work with children with autism, the first thing we need to support before even providing them therapies like occupational therapy or speech and language therapy, we need to first understand what they try to communicate to us with their behavior. We need to understand their behavioral communication, I would call it rather, because that is the first language they speak. Behavioral communication is the first language. And once we start their language, that is their behavior, we are on the same pitch. So they respond much better to our therapy programs. So understanding behavior is not only essential for parents, but it is also very, very essential for all therapists, special educators, school teachers. Though we call it like behavior modification is part of, behavior practitioners or psychologists. Okay, scientifically, behavior practitioners, ABA therapists or behavior practitioners, they work for behavior modification. But in general, it is very important for all of us, be it a speech and language pathologist, or be it a developmental pediatrician, or be it a school teacher or special educator. It is very, very important for all of us to understand the communication child is trying to do through his behavior or her behavior. So what is behavior? Behavior is anything a person does, any observable action or response. It includes any movement, speech, speaking, react, any reaction, think and respond to people or the environment. So behavior in simple terms is action plus response to a situation, how we react. We are here in this webinar now. Tomorrow we may meet at some place, maybe in a conference or maybe in at an airport or somewhere in public place, in a mall, shopping mall, and we recognize each other. We say hi to each other. That is also a behavior. We just wave at each other. That is also a behavior. And we just turn back. We look at each other and turn our faces and go away. That is also a behavior. And each of this behavior, when I'm looking at you or you are looking at me and we are waving at each other, that is a communication. What is the communication behind this behavior? That we are happy to see each other, or saying hi to each other is again a similar communication that I'm glad to see you. But looking at you, and if I turn away, if I just turn my face and go away, or if you turn your face and go away, that is a behavior. And that behavior, the reason, the purpose, or the function of that behavior is avoiding, ignoring, that you are not pleased to see me, or you do not want to speak to me at that hour, or you are too occupied and you want to avoid talking to me. So that is, there is a purpose. So any behavior, any action we do, any observable action or response we give to the environment or to the people is called behavior. And the reason, what is the reason behind this action is the communication. That is called behavior communication. So in short, as I said, behavior is action and response to a situation together. So our children, when they are doing a behavior, suppose a child who is throwing the objects. Now I start scolding that child. I start shouting at that child. And I try to control that behavior. But I'm not, at times I'm able to achieve, but again this behavior happens. Again I scold. Maybe the next day again the same behavior happens. Then I need to think that what I want to do. I want to change the behavior or control the behavior. So we don't have to control, we have to modify the behavior, and modification can happen only when we understand why this behavior is happening. So WHY is the main key in understanding behavior. Examples for, if I talk about children, crying when hungry or smiling when happy, running away from loud sound, sharing a toy with a friend, or throwing objects when frustrated. All of these behaviors, some are acceptable, some need guidance, but all carry a meaning. If a child is crying when child is hungry, if a child is smiling when child is happy, or child is running away from the loud sound, there is a meaning, there is a reason for it. WHY, why a child is crying? Because child is hungry. So the reason is hunger. That is the internal response to the internal environment. So environment, when we talk about child environment, there are two types of environment. One is internal. Internal as in if I have pain in my body, if I'm hungry, if I'm having gastric issues, if I'm feeling uneasy, if I have headache or any other internal sense. If I'm feeling sad, that is my emotions. So that is my internal environment. Then external environment. External environment is people around me, or physical things around me, lights, sound, or furniture, or toys around me, or people, other children, my parents, family members, classroom. All of this together makes external environment for the child. So my response as a child to my internal issues is my turns into behavior. As if I'm with autism, my response to my external environment also results into behavior. If it is too loud and I am hypersensitive towards auditory, so then I definitely get disturbed with loud noise. I try to run away from there, or I start screaming, I start shouting. So all of this happens. So we need to understand, if we want to change the behavior, we need to understand why a child is behaving this way. So behavior has two sides: observable behavior and internal behavior. Observable behavior is what others can see, what I can see in a child. Is child is crying, child is shouting, child is jumping, child is hugging, that is, or child is waving hand, that is observable behavior. And internal behavior is what happens inside: thoughts, feelings, motivation. I'm happy, I'm sad, I'm down, I'm low on energy, I'm hungry, I'm feeling weak. All of this is internal behavior. Even though we see only the action, every behavior is driven by an inner reason or emotion. So we actually see the action and we try to correct the action. That's where we fail. So today in this webinar, we will first, it's the first webinar, maybe to know more about behavior. We may do a couple of other sessions in future. But today, the message I want to convey, or I want to convince you all, is that we are just seeing behavior superficially and we are trying to correct behavior superficially. And we are not able to achieve what we desire. So if we are seeing the behavior actions and we are just trying to change actions by controlling them, by way of punishment or way of screaming or shouting at the child, we're just trying to change the action. But every behavior is driven by an inner reason or emotion. So definitely there is a reason which we need to find out. It could be a reason, it could be emotion that we need to look into. So behavior in autism, in our technical language or scientific language, we call it the function. Function is the purpose of a behavior, the reason of the behavior, what child is achieving by doing that behavior, that we need to look into. Why child is doing that behavior, why. So the purpose or the function of the behavior. Every child serves a purpose. It helps child to either to get something, that is attention, object, food, avoid something, that is noise or difficult tasks, express an emotion, that is fear, anger, excitement, or seek sensory input, like spinning, hand flapping, is to do the sensory integration. So to seek any sort kind of sensory input, they do all this behavior. Now you recall those behaviors, which while counting from 0 to 10, we were discussing about behaviors. So just recall them and put those behaviors in these things. The behavior of throwing object, or behavior of crying, or behavior of running away while doing an activity, or throwing toys away, or behavior of hand flapping. You can just find the reason easily from this list. Each behavior, you just put it here and you will know the reason or the function of that behavior. And when you change the function or when you work with the function, automatically the behavior settles. So no behavior happens without a reason. I will be sharing these slides. I will ask the coordinator to send you all of these slides. So need not to worry. You can sit back easily later on after the session, maybe tomorrow, day after, whenever you find time, and make a list of the all behaviors in your child which are really bothering you, which you want to work on, and then divide them as per the function. Try to find out the function of those behaviors. So you need to analyze the situation when that behavior is happening and what is child achieving by doing that behavior. So common behavioral concerns in autism are hitting, biting, pushing, screaming or crying frequently, repetitive movements like flapping, spinning, resistance to change or transitions, difficulty in sharing or waiting, low attention span, or impulsivity. These are the very common behavior concerns. So most of the behavior which you see in your child, you can just put them in these categories easily. So repetitive actions, meltdowns or withdrawals, avoidance, these are the most common behaviors. Why do these behavior occur? Now, what are the reasons? In autism, there are these 5 categories you can relate these behaviors with. Either these behaviors are related to communication difficulties, that child may not know how to express needs. Child wants a toy, but child is not able to communicate to you, then child starts crying or jumping or screaming. Or it may be because of sensory sensitivities, as I've given you example about noise, or you may see the light, the touch may overwhelm them. Frustration or anxiety, sudden change or unclear expectations. Child was not prepared to go to a therapy center. Child wanted to take some rest, but Suddenly you ask him to get up, we are going to therapy center or we are going to garden. The child is uneasy, restless. You are sitting with a child doing an activity. Child does not know when this activity will end. When will I get to do something different? And child feels that this will go on forever. And that turns into the frustration. If you do not know, now we have started this session. If you do not know when this session will end, how would you plan your further things? Maybe your dinners or other bed routines, other things are pending. So, how would you plan them? Now you have a facility here that you, whenever you want, you can exit. Suppose that facility is withdrawn. You are bound to be in this session. And without telling you when this session would end, how frustrated you would feel. Initially, for 5, 10 minutes, 20 minutes, you may feel related, and then slowly you will start feeling frustrated. So, this is what happens with the children with autism when they are not made aware about their routine. So, they are kind of uneasy. They do not know what's happening next, and they feel frustrated. Need for predictability. That's how routine brings security. So children with autism, they need predictability. They People say that they believe they follow a routine, they love to be in a routine. The reason is they want to be predictable. They want to know what is happening next, how long this is going to go on. And that's the reason if they have a routine, daily routine, they follow it in much better way because they are aware about what next. Social understanding gaps. In autism, you find a lot of concerns related to social understanding, related to reading others' emotions. We call it theory of mind. Children with autism, they don't easily connect with theory of mind. Theory of mind is that your emotions are different than mine, your feelings are different than mine. Children with autism find it very difficult to understand. If they are happy, they feel everybody should be happy. If they are sad, they feel everybody should be sad. So if a child with autism is sad and you are happy, you are cracking a joke, that creates another anxiety in them or another frustration in them because they don't relate with this that other person have different feeling than mine. So they find it troublesome to read others' emotions. That is what brings the behavioral concerns in these children. So majorly, we need to work on communication difficulties, sensory sensitivities, predictability, and need to avoid sudden changes and need to make them understand others' emotions. Then you will see that a lot of differences there in their behavior. Observation is the first step to understand behavior. The major mistake, what we do during a behavior, just touch your heart and say, the behaviors which we just thought about, take any one behavior and just read your reaction. How did you react to that behavior? When your child suddenly threw away the books or threw away the food platter, how did you react to it? Your reaction is usually screaming at the child or shouting or feeling ashamed. Whereas we need to stay still and observe. Observation is the key because you need to find out why child has done this behavior. So to understand this why, you need to observe. So observation is the first step in understanding a behavior. Behavior is the first language we adapt in our life. And it is the one that never disappears. I live in India and I was born in the northern part where Hindi is spoken very commonly. So my first language was Hindi. And then I shifted to the southern part of India, did my college from there, where Tamil is spoken widely and English is also very common. So I shifted to Tamil and English. So from Hindi, I went to Tamil, I went to English. And then later on, I came to the other state, the western part of India, where we speak Marathi in common. So I shifted to Marathi as my language. So languages we learn, we shift, we keep with them, we go on with them. But behavior is a language which we learn for the first of all. It is by default we learn it. We learn it from our environment. And that is the one which never disappears. Now I'm speaking to you all in English. Now there is no Hindi at this hour. Hindi is disappeared, but my behavior is still there. Sometimes I'm smiling, sometimes I'm moving my hands, or sometimes I'm looking at your faces. So my behavior is still there. So behavior is the first language we adopt. It begins in infancy and stays with us through life. Words may change, but our actions always continue to speak. Understanding this language builds the bridge between the child and the world. Because the children, especially children with autism, they communicate a lot through their behavior. So the key is to understand their behavior, understand the reason of the behavior, connect with them. That brings the connect. Because if you speak English and I speak English, then only we can develop, if we have a common language, then only we can develop a connect. If suppose you are speaking in some other language, say in French, which I don't follow, we both cannot hold on a conversation. Similarly, if you do not understand child's behavioral language, you cannot develop a connect with the child. You will find it very, very difficult. So once you start understanding his behavioral language, the connect is very easy. Then child can learn your language, child can learn your therapies, child can respond to your teachings very well. So behavior as a communication, if we look at, behavior is not good or bad. It is always meaningful. Sometimes we say it is bad behavior, you know, putting my finger in my nose in public is a bad behavior, or putting my thumb in my mouth is a bad behavior, or hitting someone is a bad behavior. No. For children with autism, nothing is good or bad. So do not teach them the concept of good behavior or bad behavior. Rather, try to understand what is the meaning behind this behavior, why a child is doing, and teach alternative replacement behavior to them. Okay, this is the need. You need to fulfill this need by this behavior, not this behavior. So you need to teach replacement behaviors or alternative behaviors to them. So behavior is not good or bad. It is meaningful. It tells us what the child needs, feels, or struggles to express. Before words develop, behavior becomes our language. Babies cry, smile, move, or look away, all to communicate. Every gesture, facial expression, and sound carries a meaning. This continues as children grow, especially in autism, where verbal language may develop later or differently. So behavior is communication, the first and most natural one. If you see a child, a newborn child or very infant, I mean, a child who is 1 month, 2 months, 3 months, when they cry, crying also has patterns. If you observe very clearly, the sound they make while crying communicates if they are hungry or they are distressed or they are uneasy or they are feeling sleepy. You can make out with the different crying patterns. So by crying also in different patterns, they communicate with you. You need to understand. Usually the mothers do understand this, but for others, all other family members, child is crying, child is crying, child is crying. But a mother or grandmother would say that child is crying because of hunger, or child is feeling sleepy, or child has some gastric issues. That's why child is crying. So behavior is communication, the first and most natural one. It is learned very naturally. Every action is communication. When it comes to children with autism, every action. So even when a child is not using words, their actions, sounds, the sounds they are making, movements or expressions are their language. Let's look into some examples how behaviors speak. So crying or screaming, possible meaning can be, I need something, I am uncomfortable, or I am overwhelmed. Throwing objects, maybe I'm frustrated, this is too hard for me. Running away is I want to escape this situation or I need a break. Covering ears, it is too loud or overwhelming. Avoiding eye contact is I'm anxious or I need my own space. Suddenly laughing, I'm excited or I'm trying to regulate myself. Hitting or biting, It can say, I can't express my feeling with words. That's why I'm hitting you or I'm biting you. Holding your hand or pulling you is come with me. I need help. I need support. Turning away or shutting down. I'm tired or I need time to calm. These are the most common behaviors which we try to correct, which we want to avoid. We say these are the behaviors which we want to work on. So possible meanings I'm giving you, not necessarily this is the exact communication child is trying to do, because in autism, each child communicates, each child behaves differently. So your child may be trying to communicate either of it or maybe something different that you need to observe and find out. Behavior is not random or sudden. It's a voice without words. Many parents come to me during the consultation sessions and then they say that child is doing an activity and suddenly child runs away, or child is sitting calm and suddenly starts screaming. So my dear friends, no behavior happens suddenly. No behavior happens without a reason. Definitely there is an antecedent to that behavior. Antecedent is there is a reason for that behavior. We need to look into that reason. Child is doing activity with you very comfortably. He is engaged in that activity. Suddenly there is a sound in the environment which is disturbing him or which is breaking his attention. He runs away. Or maybe child is tired and he wants a break and he runs away. Maybe child has lost his interest in that activity and he runs away. So nothing happens suddenly in this world. It takes time to rain. From ocean, from the rivers, water evaporates and then it turns into clouds, and clouds kind of crumble together, and then it becomes the humid environment, and then it rains. So it takes time for everything in this world, from a seed to grow as a tree and start fruiting. Takes time. It takes time for the flowers to bloom. Similarly, it takes time for behavior to be visible. And definitely there is a reason. So it is no behavior is random or sudden. Stop complaining that there is sudden behavior. Instead, write down when that behavior is happening, how many times it is happening, and try to see what are the possible reasons for this behavior, what are the antecedents for this behavior, and how we respond to that behavior is also a motivator for the behavior to happen. We will look at it in further slides. So the core idea is every action tells a story. If we listen carefully, if we understand what the child is trying to say, instead of focusing on stopping the behavior, because most of the time our focus is on controlling the child, on stopping the behavior, we should ask what my child is trying to communicate through this behavior. So take a pause, be observant, be silent. Don't start giving instructions to the child when child is already in a behavior. Child will not listen to your instructions. This may aggravate the behavior. So take a pause, look at the child, analyze the situation, and try to understand what child is trying to communicate to you through this behavior. So behavior, as I said, is communication or a message. There is always a reason behind every action. Children use behavior as a tool to express their needs, feelings, or challenges. When adults decode this behavior, they can respond with empathy rather than punishment. So when we understand this behavior, what is their need, what is their feeling, what is their challenge, we can work on that. Rather than punishing them or rather than giving them more instructions or sensory overloading them by commands, we can support them. We can give them strategies to meet up those challenges. We can make the task easy for them. And this will change the behavior. This will modify. So the strategies are observe, understand, and then respond. So first you need to observe the behavior. You need to understand the reason behind the behavior and respond to the reason. Don't respond to the behavior. So far we have been responding to behavior. Do not respond to behavior. Respond to the reason behind that behavior. Replace action with reflection. This is the second strategy we need to follow. So when a child shows difficult behavior like crying, shouting, hitting, or refusing, our first impulse is often to react emotionally, that we start scolding, shouting, or feeling frustrated, or we start kind of consuming the child. We show our emotions or we react emotionally. But effective parenting or therapy requires to pause, observe, and think, to reflect on why behavior is happening instead of just responding to what we see. So do not respond to what you see. Respond to what is the hidden reason behind what you see. So first strategy, observe, understand, and then respond. Second is replace reaction. Do not react with reflection. Reflect. Connection always comes before correction. So before correction, you need to have connection with the child. Once you have the connection with the child, correction becomes very easy. And how will you develop that connection? By understanding child's behavior, by making a list of all possible all behaviors, by writing down the reasons for those behaviors, possible reasons, not necessarily you will reach to the conclusion in one go. So possible reasons for those behaviors, and then giving confidence to the child that I, with empathy, that I understand what you are facing, I understand your needs, supporting the child. Then you develop the connection with child, and correction automatically happens. You don't have to correct behavior. You have to eliminate the reasons for a behavior. Behavior automatically goes away. So children with autism may not say it in words, but they show through their actions. A tantrum might mean I'm tired. Running away could mean this is too noisy. Hitting might mean I need attention. When we decode behavior, we build the connection with the child. We need to change our lens. Change our lens, how we look at the behavior. So instead of asking, how do I stop this behavior? Now we will have a question answer after this session, after these slides. So nobody should ask me, sir, how do I stop this hitting behavior? Instead, you yourself need to find out, what is my child trying to tell you? What is your child is trying to tell you by doing hitting behavior? This shift changes frustration into understanding. So the shift, which is frustration for us, that we are frustrated with child's behavior, or we are agitated, or we are emotionally distressed, or we are ashamed of our child behavior. Instead of that, we shift it to the understanding of the behavior. Now we need to support positive behavior support. The strategies are identify triggers and adjust environment. As we know, behaviors are visible actions to the environment. Environment is what? Internal or external. I have told you already, internal is my emotions or my body needs, and external or sensory needs, and external is people or physical spaces which I am living into. So that is the response. So identify what are the triggers. Is it the noise which is bothering me, my child? Or is it the lights which are bothering my child? Or is it the temperature which is bothering him or her? So what are the triggers, and make adjustment in the environment for those triggers. Use clear and simple language. Children with autism often struggle with language, so we need to use clear and simple language. Reinforce good behavior immediately. So whenever you see good behavior, you need to reinforce. Reinforce in the sense you need to motivate the child, you need to appreciate, or maybe in terms of providing some, reinforcement like a toy as a reward or a chocolate as a reward initially, to make that behavior happen again. Build daily routines and predictability. So you need to build daily routines and be predictable to the child. If you're taking the child out to a mall, where are you taking the child? Why are you taking him? Do not misunderstand your child. Most of us become non-verbal with our child if a child is non-verbal. My dear friends, your child is just non-verbal, but his auditory system is working. You need to talk to him. If a child is speaking one word, we start speaking one word with him. Why? If a child is speaking one word, still we need to continue speaking to him full sentences, maybe in a slower pace, maybe in simple language, or in a clear tone. Then only a child will learn further. So many parents say, no, he doesn't understand. That's why I don't tell him this. He understands everything. He is not able to express, but child is understanding. Or even if child doesn't understand, you do your effort. So build daily routines, predictability. If you're taking child out for a shopping mall, inform him we are going to the shopping mall, which shopping mall, why are we going there, what are we going to do there, and when will we be returning from there. All of this should be communicated. What will we do after coming home? All of this should be communicated to the child. Then you see your journey with your child will become more engaging and less of troubles or less of frustration for you. Use visual schedules and cues. So wherever possible, use visual schedules for your child, or you can have visual cues for your child. Provide sensory breaks. Do not keep them engaged for a longer period. Give them some sensory breaks. If your child needs sensory support, so give them 5 minutes break, 10 minutes break of to fulfill their sensory needs. To change the behavior, first understand the reason, purpose of that behavior or function of that behavior. If it is environmental, make corrections in the environment. And then change what happens before the behavior. Write down what happens before the behavior. Change what happens after the behavior. So what happens before is called antecedent. What happens after, consequence, that is our response to that behavior. Change that also. So we need to change. Behavior always lies between the two, antecedent and consequence. Both are under our control. Behavior is not under our control. Most of the time we spend our energy in correcting the behavior, but behavior is not under our control because it's child's communication, it's child's action. What is under our control is what happens before the behavior, antecedent, what happens after the behavior, or how we react to the behavior is consequence. So make a list of challenging behaviors of your child. Try those positive strategies which I've told you. Be observant every time when you make the list. Find out the reasons, what could be the reasons, purpose, or functions of that behavior. If it is environmental, make corrections in the environment. And then what happens before the behavior and how we are responding to that behavior, or what child is achieving by doing that behavior. Change that. That is the last strategy I'm giving you today. Change that. Change the antecedent or consequence and your response to the behavior. You will automatically see an improvement in the behavior. Now, when you are done with all of it, okay, one side you are trying all of it, but same side, you need to teach replacement behavior to the child. I want to communicate to you. I want to say, I'm thirsty. Give me water. Now, there are multiple ways of saying it. One is give me water. But if you are not happy with this line, you can teach me how should I ask for water. My need is water. You need to teach me alternate strategy. Until you teach me the alternate strategy or replacement behavior, I'll keep on doing this behavior in spite of you changing antecedent or changing consequence or making corrections in the environment. I'll keep on repeating the same behavior. You will say, Dr. Alok, you had given us these strategies, but that are not working. So one side, you need to work on those strategies, which I am saying, but the other side, side by side, you need to teach replacement behavior to your child. Do not teach replacement behavior during the behavior. Oh, you want a chocolate? Child is crying for a chocolate. We say, no, stop crying. And then say, please give me mama. And then only I'll give you chocolate. So during the behavior, you are trying to teach a replacement behavior, which is very, very difficult for a child to learn. Because child is already in a behavior, child is already trying to communicate something to you and getting frustrated why you are not understanding his communication, getting frustrated of that. And at that time, you are teaching another replacement behavior. So no, replacement behaviors should be taught separately. When child is in a good mood, child is doing games with you, child is playing with you, or you are doing an activity, or it should be planned in your routine therapy practice. So replacement behaviors, you need to first find out the behavior which are troubling you, the behaviors which you need to motivate, which are positive behaviors, the behavior which are troubling you, find a reason for them, and then make corrections in the environment and find out the antecedent and consequence, work on both of them side by side, teach the replacement behaviors to your child. So teach him how to ask for a break, teach him how to request for help, or teach him how to say no. When he doesn't want something, to say no. Maybe verbally or through gestures, he can communicate. So make a list of common patterns of your child, common patterns of behavior of your child. Be compassionate. Effective behavior management blends love with science. So far, whatever I've told you is behavioral science, but you need to add on your compassion into it. Be you are a parent, or be you are a therapist, or you are a teacher. Do not to work on behavior just very professionally. You need to have some angle of emotion, that is love in it. Then you will see wonderful result. Have clear communication with the child. In smaller words, some clear, small instructions, clear words with normal tone. Have patience and consistency. Whatever you're trying to teach, you need to, with children with autism, you need to have patience. You need to be consistent with it. Common mistakes that we need to avoid is yelling or punishment, inconsistent rules, that okay, today we make one rule and tomorrow we change the rule. No, if we are making some rules, I'm talking about the common mistakes that you need to avoid with children with autism. Today's session is focusing on children with autism. So the rules which you are making, you need to be consistent on them. Ignoring good behavior. If a child is doing a behavior or even trying to do a good behavior, you need, and you are ignoring it, that is also not good. You need to reinforce. You need to appreciate. Expecting instant change is also very difficult. Child has learned this behavioral communication over the years. This is his communication. This is his language. Today you speak English, and suddenly if I expect you to start speaking in French, is very difficult. Word by word, you will learn with time. So expecting instant change is difficult. You should not be doing that. Overwhelming the child with demands, putting too much of pressure on child should be avoided. So patience and positivity brings progress. When parents learn to understand behavior, they become child's strongest support. So observe, understand, and respond with love. Every action tells a story. Let's learn to listen. Summary is the golden rules: understand before reacting. Do not react, first understand. Reinforce the positive ones. Be consistent. Stay patient and empathic. Remember, behavior is a communication. Thank you for joining. That is all from my side. I wanted to keep it very short and crisp. So let's remember, every child's behavior is a message, and every message deserves to be understood. You may join with our mission, JKP Care Foundation's global parent and professional community. If you are a professional expert in your own field, you may join us. You may connect with us, and we'll give you opportunities to create, to support people, support parents group, and create some webinars. We also have certified autism training programs with autism, ABA, speech and language therapy, or various uh, primitive reflex integration or sensory integration trainings. So you may join them. We have parent empowerment courses as well. Early intervention resources also we have through our cat and pet therapy sessions. Online schooling, as I've told you, Aspire, which is a new online school which we are starting from tomorrow. So online schooling, online therapies are also available. If you are running a center, or if you are running a school for special children, especially for autism, you may get into association and collaboration with us to get your team trained, or for the assessment of your children, or for in general guidance about the progress of the children. Together we can make a difference. That's all from my side. Now it is your turn. I'm stopping this screen sharing, and I'm open to your questions. So you may ask your questions, share your insights and feedback, and take personalized guidance. I'm available as long as you all have questions. So you can unmute yourself and open your camera and ask your question one by one. I can see some
Sir,
messages in the group. Yeah,
yes,
Brenda.
there's a question in the chat box.
Mhm. So Dr. Kanchan Kaur is saying child need attention. Now, Dr. Kanchan Kaur, can you please unmute if you're there and please elaborate? What is the question? Till then, I'm going to the next question from Asima. If a child is crying during therapy, so we should stop the therapy or we should continue? A very relevant question. Child, as I said, even if we are a speech and language therapist or a special educator or whichever therapist we are, behavior is something that we all need to handle. So if a child is crying, again, you don't have to stop the therapy or you don't have to continue the therapy. First thing is you have to work on behavior. Your therapy comes little later. First, try to understand the reason for this crying. Maybe your therapy goals or therapy plans are more difficult for the child with child. Maybe you're not able to connect with child, like, your child is not understanding what you want to do with the child, or maybe child is not happy with the environment. So again, the same strategies which I told you. First of all, take a pause, try to understand the reason behind that behavior, do the environmental analysis. If there is something in the environment in your therapy center, noise, other children crying, that noise, or the temperature of your AC, or the lights, bright lights, or sound, what is troubling to the child? Try to understand that, make corrections in that environment, and then work on antecedent and consequence. What has happened before the therapy? What has happened before the child? Maybe the transition from the parent to you as a therapist. Some children are not very happy with this transition because they were not prepared for it. They feel that this therapy will continue for long. My mother has left me here. Now I'll be here forever. That is autism. So they do not know that after 1 hour, after 30 minutes, this therapy will end. I will go back to my mother. My mother is waiting outside for me, or my father is waiting. They do not know that. So make it predictable. Let the parent prepare the child first before handing over the child to you. If required, let the parent sit with you for first few minutes in the therapy. And then you see crying behavior will slowly disappear. You need to work on consequence or antecedent, predictability or environment. I hope I have answered it. If you have any concern, you can unmute and speak. Asima? No? Okay. Next is Zubeda Shaheen. I would prefer if you can unmute and speak, ask your question. How can we convince parents to allow their children to participate in group sessions? They say their child might learn bad behavior from others. Now, no behavior is good or bad. That we need to convince. So first thing is, education to parents is very important. We need to conduct some sessions like we are conducting it today, webinars, free sessions for parents, awareness sessions for parents. We need to conduct those sessions and need to convince them. So convincing is the role of major role of psychologist. If you have a psychologist in your team who can work as a counselor and connect with parents and counsel them, that will give you better results. Or you need to apply different strategies. You need to make smaller group of 2 or 3 first, and show the improvement. Show what you are achieving by doing this group session to the other parents, modeling. So modeling technique will help you, because if you make a group of 3 children and you show remarkable improvement in those 3 children, other parents will automatically ask you to include their child also in this group. So for sometimes, to sell my fruits, I need to make my customers taste them. When we go to the shopkeeper, at times he makes us taste something, a sample, taste it, and then you end up buying it. So you need to feel that improvement. You need to feel that, make them feel that improvement will come, give them hopes, and also give them confidence that you are working on the behaviors that are troublesome in other children through your communication, and your child will make sure that the child will not copy or learn those behavior. Next question from Karishma is, hello, my child is verbal, picky regarding her food intakes. At time I feel guilty for having to force her to eat. What can I do to make her like the food? Child is picky eater, very common in autism. First, we need to understand why child is picky eater. Is there any sensory issues in oriomotor sensory issues in child? Or is there any oriomotor issues in the child? So there are two things. Some children, they are not able, their muscles of jaw or tongue, they do not have that much of strength, because of which they are not able to chew or not able to gulp the food. That is one area which an occupational therapist can do an assessment and help you out with oriomotor assessment. The second area is sensitivity in the mouth. Again, an occupational therapist is the right person to help you with that. So you need to do an assessment. Some children do not are very sensitive and they do not like crunchy food. Some of them, they do not like soggy food. They want to eat only crunchy food. So that these are the common reasons for picky eating in autism. At times, you feel guilty for having to force her to eat. You don't have to force her. You first need to make a list of items that your child is able to eat. If she is able to, or she is willing to eat. So you need to find out the common similarities between those items. Is it the crunchy food which your child is liking? Then try to make other food also, whatever you want to feed the child, in the same texture or same crunch or same flavor. Or is it non-crunchy food, that is the soggy texture the child loves? Try to cook other dishes also in that texture. You don't have to feel guilty and you don't have to force feed her. Force feed will bring behaviors and child will be always be uneasy. Sometimes they are picky eaters of choice because they have options available. That is also another reason. Okay, you are not eating this. Oh, my child, because of my emotions for my child, I say, oh, he should not or she should not remain hungry. So, okay, you want to eat chips? I'll give you chips. No problem. I try to feed the staple food, whatever we eat at home, I try to feed that to my child first. But child refuses it because child knows once I refuse this, I will get chips, I will get chocolates, I will get biscuits or cookies or cake and pastry, which children usually prefer. So when they know that option is available, when they know that mother is weak enough that she will surrender, then also they do this behavior. So sometimes if a child is hungry for 2 hours, will not make much difference. But do not give options. Try to repeat it for 2, 3 days, 4 days. You will see that child will start eating whatever you serve first. So first you need to find again the reason, eliminate the sensory issues or the motor movements issues, muscle strength. First eliminate that. If that is working, fine. If that is not working, then you see it is out of behavior. Child has learned this because child knows that options are available and options will be given to me when I refuse eating this food. Then let child wait, hold on. Nothing will happen if a child is not eating for 2 hours or 3 hours. So if a child is skipping a lunch, nothing will happen. 5 o'clock, if you take lunch at 1 o'clock or 2 o'clock, I'm assuring you, by 5 o'clock your child will eat whatever you want him to eat or her to eat. If it is because of behavior, if it is because of picky eating, as in by choice, as in by I know that option. So first you need to know why a child is picky eater. Okay. What you can do to make her like the food, make a list. I've already told you, make a list of his favorite flavors, make a list of favorite food. Try to create other food in similar flavor or try to mix it up. Like if my child likes cornflakes, strawberry cornflakes, uh, I can add on strawberry cornflakes 70%, but 30% other cereals into it. So mix a bit of the other part and slowly increase the other part. So the taste buds would automatically adapt to the new flavor. Very first day, 90-10, ratio of 90-10. Second day, ratio of 85 15, then 80-20. Slowly increase that for 2, 3 days. It like maybe after 15 days, you should reach at 50-50. Then slowly child will adapt to the new taste and flavor. Okay, Karishma, you there?
Good evening, Dr. Alok.
Yes, yes. Good evening. Good evening.
Thank you for the valuable webinar and all the best for your online startup tomorrow, online
Thank you so
schooling.
much. Thank you so
And
much.
My takeaway is I feel like this is this will help me during the behavior. Don't teach the replacement behavior, which you told. Today I
Mhm.
observed. I'm just sharing the experience in the classroom.
Yeah.
Today, one of my LSA, she was trying to teach to ask for a water. She is giving a correct word, like only one word she was teaching water, but the child was not ready to take that. He just grabbed
Mhm.
the bottle, he went outside, opened, he finished the bottle, he threw it away. In spite of
Mhm.
that, I think she has to do modeling when he is in a good mood.
Yes. Yes. Agreed. Thank you
So
so
I
much.
think
Thank you for
I will follow this one.
Yes,
Thank you.
yes, thank you. Thank you very much for your feedback, and I'm very glad that you are able to connect with it. It was a very short session, but if you're able to take something from it, I'm very happy. For any further support, you all, I'll be sharing this PPT with you all. My contact number is there. You can connect with me if you need.
Yes, I think
And
I may need because I'm in between. Like most of them, they go for a psychometric assessment, and
Mhm.
from there they get a report, a clinical
Mhm.
based assessment report. There they will mention like in 1 hour we did the activity and the setting tolerance for only for 2 minutes. This all we know. That is the reason we guided to you.
Mhm.
But what is after that? What a therapist or the LSA has to do after that? I couldn't explain them clearly. So I need like few clarification, which I will be connecting to you later on.
Sure, sure. You can connect with me and we can work on it. No problem. I
Okay,
also
okay,
want
thank
to
you.
thank I want to thank Brenda, who is here with us, and for initiating this webinar. It was Brenda's idea that we should do this. Parents are struggling, and she is an advocate. She's a special mother and an advocate for special needs, neurodiversity in Mauritius. So thank you very much, Brenda, for connecting with so many people, bringing them here, and initiating the thought. So all the hard work you have done behind organizing this event. Thank you so much.
Always a pleasure, sir.
Thank you. I'm really amazed. Being I think you are a professor for mathematics or chemistry.
No, sir, physics.
Physics. Okay, I didn't take that.
Yeah.
Okay, so being from the background of physics, being into the academics, and then you are doing so wonderful job. I'm amazed to see the way you are working in Mauritius, working with the Ministry of Mauritius, trying to create awareness about special needs and fight for the rights of special needs. I sincerely appreciate to you and my whole with full team. I'm there to support you anytime in this noble cause.
Thank you. Thank you so much, sir. I see there are more questions in the chat box. I
Yeah.
think there's one parent asking about leucovorin. Again, this is a question which keeps popping up.
I'm
I
coming
believe
one by one.
it's
I'm coming to all the questions. As I promised, I will not be ending before completing all the questions today. So, next question is there from Logan Subramanian. I have a
yes,
non-verbal five years old
that's me.
son.
If you want,
Yeah,
I
Logan.
can ask you my question.
Yeah. Please.
Yeah. So I'm Logan Subramanian. I'm from Mauritius as well. Thank you very much for that really insightful presentation that you did earlier, and thank you very much for Brinda as well to put that together to raise this awareness and help us parents and professionals to help these children who really need us to understand their way of living so that we can get into help them to fight life, I would say, to grow up with this challenging experience. So I've read quite a bit about leucovorin, and I would like to know what is your view on that medication.
Okay. See, first of all, I want to give a disclaimer that I am a clinical psychologist and I am not medico practitioner, so I am not the right one to give a comment on it. But however, as per my knowledge, as much I know, leucovorin is folinic acid, and it is like an active form of folate, the vitamin B9. And nowadays we are seeing many parents, there's a lot of things going on media, also on social media, that start giving leucovorin, and it is helping children with autism. Indeed, it is helping children with autism, but not all children. It is like GFCF diet, gluten-free, casein-free diet, we give to some children with autism who have gut leakage issues. We don't give it to all children with autism. So only say 4% children respond very well to GFCF diet in autism. So first we need to see whether my child has low folate levels. So if the child has low folate levels or cerebral folate deficiency, then only this leucorvin should be prescribed. So it is not for all the children. First, you need to go to a developmental pediatrician, do some tests which we need to do, and then give the right doses. But first thing is, if the child, there are many children who have low folate levels in cerebral folate, and they have this, they call it, the condition is called as CFD, that is cerebral folate deficiency. So if the child has CFD condition, only after doing a proper blood test, and it should be prescribed as per the prescription should be given as per age, body weight, and as by a medical practitioner, a licensed medical practitioner. So not all the children. I've seen many parents on social media just starting it, and just I've seen comments on that also. I started with 0.2 mg and now, sorry, 0.5 mg. Now I'm giving 2 mg, and child has started speaking in 3 months, or speech has become better, or I can see repetitive behaviors have gone. All of this I'm reading. But my strong take here is it is not for all children in autism. It is not a medicine for autism. Yes, because of low folate levels, there are some children who have cognition issues, who have issues related to their speech and language. And once their folate levels are better, the deficiency is gone. They respond to it like they're showing improvement in their situation. So it is not a medicine for autism, but it is a medicine for their cognition level or for their repetitive behaviors, which can be worked upon. I hope I have answered it.
Yes, you did. So
Yeah.
we need to do the test first. And
Yes, you need to go to a licensed medical practitioner, usually the developmental pediatricians. You need to go to them, discuss with them on this. They will give you more insight because my knowledge is limited to this subject. I have just shared what I have, I have read and whatever information I have with me.
no,
I
great.
have,
Thank you very much for that.
if you message me, I will share a document also on this. I have written an article before just couple of weeks, so I can share that article with you. You just WhatsApp me. My number is mentioned in the PPT. You will receive the PPT. Just WhatsApp me, and I'll share that article also. Okay.
Great. Thank you.
All right, so let's go with the next question now. Kavitri. Kavitri says, how to stop a child from putting objects in the mouth? That's called mouthing. Why child is putting objects in the mouth is sensory sensitivities in the mouth. So we need to first replace it. What is to be put in the mouth and what is not to be put in the mouth? So first we need to, I think an occupational therapist can help you much better in this, but we need to first see child is putting objects in the mouth and trying to chew them. Then there are chewable toys, chewable candies and toys, which we can give in replacement and teach the child this is acceptable, this is not acceptable to put in the mouth. So start from there and then work on the sensory issues. Sensory integration therapy, work on the sensory issues of the child. Automatically, the mouthing stops. It takes little time. So we are always scared that what if child puts something which is not edible in the mouth, which is dangerous? Then what? So first strategy is to control this behavior by giving alternate option. What is edible? So chewable toys are easily available. You can search on Amazon also. Some candies and some toys that can be given to the child, which are safe to chew. Chewing tubes are also there, so which are safe to chew. So you can give them to put. So their sensory need you are fulfilling for the time being, and then you're working on the sensory issues in the mouth. And once it is settled, automatically mouthing stops. How to potty train Shaista? Shaista, potty train has several steps into it. First thing is adjust the, thank you, Kavitri. First thing is to adjust the body clock. Our body has a clock inside, inner clock. If you start waking up every day at 5 o'clock in a continuation to 15 days, I'm sure with alarm, on 16th day, without even alarm, you will wake up at 5 o'clock. Because that is inner body clock, you set on that. It takes time to settle down, but yes, with a continuous practice, and inner clock sets. So first thing is, with time, you start putting your child on the potty seat. So depending upon child's age, depending upon child's behavior, you can decide the timings on the routine. You can decide it. So start making him sit on the potty seat with the time. So then you will know what is the time, and you can put alarm for that. Say at 8 o'clock in the morning or 7 o'clock, then afternoon 12 o'clock, and then evening. So then
Okay.
child will be. Yes.
Thank you so much. Um, uh, Actually, I've potty trained him. I think might be 3 times, and I might say he regressed or something like that, because for passing the urine, um, he does. He goes to the pot. He sits there and he do. And I know
Mhm.
his timing, his potty timing, what time he does potty. But when I take him to the potty seat, and when I make him sit there, he will fold. He'll not poop in the pot. He doesn't
Mhm.
want to poop there. But with the urine, he passes the urine. But with the
Mhm.
potty, he will just hold it, and you won't believe he had not pooped in a week, like for a week he has controlled his potty, because I was too consistent. I was like, no, you have to do this, and I have kept the reinforcement, everything possible I have done. And my son is 7 years old now. So
Mhm.
like when he was 3 years old, from then I'm trying to potty train him. And in between I have given him break, his time, everything I've tried. But now I think it's like high time he should be trained.
Okay. See, first thing, as I said, is the alarm that we can work. But the second thing is we need to screen the child for by a dietitian, because 56% children, a study says 56% children in autism, they have constipation issues or gut leakage issues, which is making it difficult for them to do. So we need to eliminate that cause also, whether the child is, it is related to diet and nutrition, and child is facing constipation, and child is not comfortable doing potty in that position, that also we need to work on. And third is the behavior that we need to teach. So if it is not because of constipation, because as you are saying 7 days he has not pooped, so
Yes.
it is very worrisome for me. So
Yes, yes.
then definitely it is because of the constipation, because it may be because of the gut leakage issues which child may have. So we need to eliminate that. I always
Okay.
believe, before working on the while working on the with such kind of concern, we need to go step by step. Like for mouthing also I'm saying one step by step, or for other behavior like crying behavior also I'm saying one step by step. So here you first make the list of all possible reasons. Possible reason could be he is not potty trained because his timings are different. So first we try the strategy with the time clock. Second is maybe because of the constipation, it is painful process for him. As you are saying, he is able to do urination properly. So maybe it is very painful for him, or he has constipation, regular constipations. It may affect very adversely in the later stage. As the age grows, it affects the development also. You know,
Okay.
you can understand, if we have constipation for 2 days, how uncomfortable we are. Our behavior
Okay.
changes. So your child is, if child is going through that phase, then we
Mm.
immediately need to work on his diet intake and diet, more of fluids. A dietitian and nutritionist may, give you better guidance. Somebody
Yeah.
who's trained on autism. If the child is on autism, we definitely need a person who's trained on autism. So if you
Okay.
have someone there, you may connect or connect with me. I'll share the contact number of one of our colleague and my senior, Mrs. Sushila Sarandar.
Mm.
She's a very senior lady, 44 years of experience in diet and nutrition, exclusively working for autism and special needs children for almost 20 years now. So I will
Okay.
connect you with her. She can give you more
Okay.
strategies for
Okay.
this.
Okay.
So
Okay. Okay.
routine, and then this constipation issues we need to look into, and then make potty a enjoyable moment for him,
Okay.
not a painful moment. So maybe the
Yes.
potty seat height is okay with him. You need to check that the environment in the washroom is okay with him, or he wants to just sit and run away from there. He doesn't want to
Okay.
sit there. That you need to screen the environment.
But one thing I have not noticed, like if he's not in the toilet, if suppose he's doing elsewhere, he doesn't sit, like he sleeps, like literally sleeps and do. Might be the position. Also,
Hmm.
I'm treating him with constipation. Also, he
Hmm.
passes like in a day twice or thrice he will poop. Still, the when we went to the doctor, they said might be constipation, and it's not necessary. If they have constipation, they'll not pass the stool. They do, but you need to treat for at least 3 months, 6 months, 8 months, depending on the severity. So he's on the constipation meditation. So let's hope for the best. Might be the position.
No, constipation medication is okay, but constipation is directly related to our diet intake.
Okay.
We need to make changes in intake. Automatically, the output changes.
Okay. Okay.
So that's the reason I'm suggesting you medicines. I always prefer to go at last. When I have
Okay.
no other solution, then I go for medication. So medication you have already started, good. Continue
Mm.
with that. I'm not saying to stop that, but at the
Okay.
same time, more of fiber, more of liquids, change the adjustments in the dietary intake will help you a lot.
Okay.
So pooping 3 times in a day is also not good. So in constipation, they don't
Yes.
poop. That is not true. You are right. But in
Yes.
constipation, pooping becomes a painful process or difficult process.
Yes.
Yes. So
Yes.
we need to,
Yes.
maybe the child is scared of that difficulty, and when child is relaxed and lying down, then only he needs to do that. So we need to first make it enjoyable process for him
Okay.
instead of forcing him to go and sit on the toilet seat. So first we will
Yes.
work on these areas, and then we will see to it. So step by step, you can stay connected with me, and
Sure. Sure.
step
Sure.
by
Sure.
step we'll work on it. Okay?
Yes, yes. Thank you so
Yeah.
much. Thank you so much.
Hello.
Okay. So yeah. Yes, sir.
Sorry, just to add on what we are currently discussing, the
Mm-hmm.
issue I have with my son is he does poop in the toilet, he does passes urine in the toilet, but
Mm-hmm.
he doesn't tell you. I mean, he doesn't speak, but he doesn't give you any sign that he wants to go to the toilet.
Mm-hmm.
That's the issue. So what I'm currently doing is I started like every 15 minutes I bring him to toilet. He does passes urine. He does whenever the time comes for pooping, he does a poop in the
Mm-hmm.
toilet. Then I've been extending the time like 15. Then I take him every 30 minutes. Then I take him every 1 hour. I've been
Mm-hmm.
extending. It works, but the thing is, I wanted like him to give me a sign, like I want to go to poop now. But he doesn't give you the sign at all. So
So you need to teach him visual cues, because till the time he is developing on speech and language, visual cues or gesture communication. So visual cues will be better. Make some visual cards for toilet training and show those, give those cards. And whenever you are going, taking him to the toilet, that time you take that card along and show it to him there. Okay, this is the card. Whenever you want to come here, you have to show me this card. With regular practice, child will start showing you that card whenever child wants to go to washroom.
okay,
So make some cards, small cards, visual cards. You can find it on online also. Or you can make it at home. No need to invest time and energy on searching it. Very simple card, which is having a symbol of washroom, or maybe a commode sign or a wash basin sign. So whenever child wants to wash hands, just show that card. Whenever child wants to go to washroom, just show the commode. And it will start with what? It will start with, now, since you are already training him with the time slots, whenever you are taking the child, you need to take that card along and show it to him that we have to pick up this card and go. So keep that card in the reach of the child. And then later you will see automatically when child has pressure, he starts realizing it, he will pick up the card on his own. Maybe after doing a practice of 2-3 months, you will reach there. So consistency is the key, patience is the key, and child will start taking the card with him. So the moment child picks up the card, you will understand that child wants to go to washroom.
Okay.
Okay, try
Great.
this
Thank you very much.
and
Yeah, I'll
do
try.
give me the feedback if it's working or it's supporting, or else we'll try some other strategies.
All right. Thank you.
All right. So next. Mhm. Okay, where I was, sorry. Okay, Karishma says thank you very much. Akansha says thank you. If we get the PPT, yes, you will get the PPT by WhatsApp. I will ask my team to forward it to you tomorrow. Okay, Dr. Kanchan is thanking Brenda ma'am. Thank you, Brenda ma'am. Okay, Sharma says thank you for enriching session. Thank you. Zubeda, some children don't know how to stop eating or drinking continuously. What is the reason behind it? The reason is the appetite, the connection from the brain to their gut. It is like, in our gut we have microbes, and it's a research which says, or very recent research in last couple of years, which says that our intestine also has cells similar to the cells in brain, and then they communicate to each other. So whenever your stomach is full, whenever you are like you're full, it sends signals from the stomach, the intestine. The signals go to the brain cells, and they sense, okay, I'm full, and I don't need to eat more. But sometimes, most of the time, it is a delayed process in all of us. It is a delayed process because of which it is usually said by dietitians that you should stop eating before 15 minutes, before, once you feel 3/4 full. Because by the time your signals reach to your brain, you are almost overfull. So whatever is your appetite, if you are feeling like to eat 2 sandwiches, you should eat 1.5. That's what dietitians usually say. Because after 15 minutes, you will realize 2 have become more. While eating, you don't realize that because there is a time delay in that communication. Children with autism, this delay is more, or sometimes this is not present. The communication, that is, again, because we know that it's neurons. Autism is what? Autism is neural disorder where we have deficits in the neural communication in the brain. So the communication from the intestine that I am full or I am hungry is distorted, because of which children with autism are, some of them, not all, are not able to communicate to you or express that I'm full, or they feel hungry all the time, or they keep on eating or drinking continuously. So that is the reason. If you know how to control this, how to work on this, is with regular practice, you know, with the time clock, with giving the right amount of food, and foods that are more filling. So that again, a nutritionist or dietitian can suggest you what kind of food or what strategies we should use for this. Okay, next is Mohammed. Thank you very much, Mohammed. It was a very short and crisp session because the timings were at late evening, so I kept it very short, and I thought we can further have more such sessions. Akansha says, really sorry, I missed attending it. Can I get the recording of it if possible? Okay, Akansha, we'll make it. Brenda has already replied to it. We'll make the recording available for you. We'll work on that, but give us time for a day. Tomorrow probably we'll do that. Okay, Selvi, thanks a lot from Mauritius. Thank you, Selvi. I'm looking forward to come to Mauritius maybe the next month, working on the plan. Deepak is saying thank you. Any more questions? Thank you, Alok sir and Brenda ma'am, Zubeda. Okay, and congratulations for tomorrow. Thank you, Zubeda. Thank you so much. Further sessions would be most welcome. Yes, I will probably, Brenda, you find a strategy, let me know, or we can discuss. Probably we can create a WhatsApp group where we can share the link with all of the people who have registered for today. They can be added to that WhatsApp group.
Yes.
And we can further keep supporting them and have more such sessions on different topics. I can bring in more professionals from various domains from my team, and we can have more such sessions. I think that would be a help we can do. So let us discuss on it. We'll work on it. Right. Okay.
Yes, so I have one
Sure.
question.
Yeah, please.
On behalf of one of my parents, he couldn't be
Mhm.
here today. So his son is 16 years old. He's nonverbal.
Okay.
So he's been potty trained before, but now he's noticing regression. He's not going to the toilet. Normally he's pooping at any time, and he doesn't give any sign and all. So he's quite worried how to tackle the situation. I've been trying to ask some questions about changes that have occurred in the boy's life. Actually, he's been going to school very rarely lately. So he's been away from school, and his mom just had a baby. So there's been quite a lot of changes for the boy. So I did not know whether this regression could be a sign of depression here, or just because of the transitions and changes.
It may be an early depression stage. So when the environment has changed, children, like children also have emotions or feelings like we all do, and they are very sensitive to the environment. And children with autism are 4 times more prone to pediatric depression, 4 times more prone to the depression. And the difficult part is autism symptoms and depression symptoms overlap in autism. So screening a child with autism for depression is becomes a little more difficult for us. So we need to carefully do the analysis of the environment, make corrections in the environment. Regression, as per my opinion, is directly related to pediatric depression or environment. So I have done a research on that also, and I am of strong faith that regression in autism is very much linked to the environment and shifts in environment and depression. So if there is a deficit or regression only in the area of toilet training or in the other skills also, we need to look into that. So if it is in the other skills also, not only in toilet, usually that happens with all the areas. So basic ADLs. So if there is a regression in that, we need to rework on the child and take him back. But same time, we need to correct what has changed in the environment, make the corrections in the environment. That is very important. Environment plays a very important role in all of our life, be it a child, be it you and I, and our behavior is directly related to the environment. If we are in a session like this, our behavior is different. If we are doing party at home with our friends and family, our behavior is different. If we are at a railway station, we behave differently. We are at an airport, we behave differently. We walk into a hospital, our behavior automatically shifts. The moment we shift the environment, behavior automatically changes. You're going to a school, as a parent, your behavior is different. You're going to a mall, to do some shopping, your behavior is different. The moment you step into a new environment, your behavior automatically shifts. So behavioral analysis is very important to understand any child's behavior, and corrections in environment directly bring the difference. Yeah. So that
Thank
case,
you.
probably, if you want, parents, since the parent is not here, maybe we can handle that case separately on one-to-one with the parent, and we can do a detailed analysis and work on that. Okay.
Yes, sure.
Yeah,
sir.
Dr. Alok, hi, this is Ranjini. Good
Hello.
to see you
Hello.
again.
Yes.
I have two questions. First is when we are observing behavior in a child uh, and trying to figure out what could be the possible reason behind the behavior, it's primarily guesswork. So I'm a bit concerned as a educator that we everything becomes a guesswork unless it's apparent that this is the reason why the child is exhibiting a certain behavior. So it becomes a guesswork, and we presume that this could possibly be the reason, and then move ahead to replace that behavior. But what if we are wrong? I mean, my question actually is, how do I understand that this is the reason why the child is behaving in a particular
Yes.
way?
Yes. So here for behavior, by one behavior, child may communicate 10 things to you at different time. Okay, so
Yeah.
ABC analysis, antecedent, behavior, and consequence analysis. There is a chart for that. There is a sheet for ABC analysis which we need to fill, where we write the behavior, we write possible antecedents and consequence, how we reacted or what child achieved by doing that behavior, for a duration of a month, 2 months, or 3 months, and then we do the analysis of it. So all the possible guesses, as you said the word, it is merely a guess. Yes, this time it is a guess. Second time, this time I have 5 guess. Next time I have 4 guess. Third time I have 10 guess. But when I do the analysis of it, then I can reach to the real one. What could be the real one? And then even if I'm not able to reach that, I make the change in antecedent, I see the shift in behavior. So which antecedent is shifting the behavior? One thing at a time. So one first change in that and first guess, behavior is still the same. Second one, behavior is still the same. Third one, behavior is changing a bit. For that also, I need to do multiple tries. In the first go, not necessarily behavior will immediately change, but we have to be consistent. So that is behavior modification therapy, which we do, and we need to try. So there is scientifically we do it with the support of making data taking and making the graphs of progress or behavior shifts. So that is the role of ABA therapist. Usually they do it, but from parents' perspective, it is sufficient to just find out, just to assume the behaviors, the reasons, and work on those reasons and change the shift. They will understand because they are spending the most of the time with the child, like 22 hours, 23 hours, 20 hours they are with them. So
That's right. That's
in
right.
a day, they will see one behavior 10 times or 5 times. So they will
Right.
understand, automatically they'll understand what child is trying to communicate by this behavior once they start observing that behavior. Modification is, if we want to go for a detailed modification, then it's a scientific process. Then we need to go for ABA therapy, applied behavior analysis, where we work scientifically on the behavior changes.
Okay. And my second question was, it's digressing from what we are talking, but in the past 1 year, I have witnessed a huge increase in the number of children who are on the spectrum. Earlier, it would be 1 in every 5 children. Now, 3 in every 5 children, especially in the younger age group, 5 years, 7 years. Is this like a global incidence that's happening? Do have others experience the same? And what could be the possible reason? Is it because there's more diagnosis, or I'm a bit stumped on that because earlier, see, I work with 2 different NGOs, and one is, for the affluent kids, rich kids. Autism was prevalent. And I also work in the most impoverished community in Kolkata, where the number of children with showing symptoms of autism and has gone up like crazy in the past 1 year. So I was just curious to understand if this is a common phenomenon that's happening, or is it the region that I'm working in, and what could be the probable cause, if you could throw some light on that.
Okay. See, when I started practicing almost 21 years back, it was, I guess, 1 in 200, 300 children. Okay.
That's right. That's
Then,
right. Yeah.
it dropped to 164, then 156, one child in 156, and dropped to again 98. And the number has been dropping as per the research. So yes, autism is a growing disorder. If we actually look at it, it is more right now than pediatric cancer and pediatric HIV and pediatric heart diseases all clubbed together. So if we club all 3 together, the cases of those and cases of autism, the number of cases of autism are more. As per WHO, it is 1 in 100 globally. As of the data of 23, it is 1 in 100 children we are seeing it. But as per the US data, it is 1 in 56, I guess. I'm not very sure on the number right now. But yes, I was reading a research which says that we are expecting it to be 1 in 36 as per US data. And by 2030, we are expecting it to be 1 in 10. So that means 10% children in the US, 10% children
Yeah.
are going to be on spectrum. Now, I agree with you. The case number, it is not with the region as you are saying, it is globally, it is increasing. The reasons could be diagnosis. I don't think it is just the diagnosis. Diagnosis has increased, awareness has increased. But if I see in general, if you go back, say 20, 30 years back, and you used to see people around you, how many children or how many adults had you seen with mental disorders? I'm not talking only about spectrum, I'm talking about in general. And now how many you see? I'm not talking about diagnosis. In generally, if I see without even diagnosis, I see the number has really increased. So yes, it could be environmental, it could be because of the food we eat, because of those all chemicals and all packaged foods. But there is no research that can scientifically prove it that this is because of this one reason. Okay. So number is scary. We are not prepared for it. 2030, 10% children. Actually, we are not prepared for it. I am seeing, India is much better. I'm seeing when I'm traveling to places, even better than the UK. I'm seeing India is much better than the Europe, though the awareness is more there. But the support system in India is much better. Appointments are easily available. Even in Mauritius, I have seen the condition is really difficult. I think in overall whole of Mauritius, we have 2 speech therapists. As per my knowledge, Brenda, you can correct me if I'm wrong. So we still have much better system and support system here. Professionals are there, but still we are lagging.
Actually, sir, in the public sector, we have only 2 speech therapists. But then in private, we do have a few, but still not enough for all the children that we have.
Yeah. So there is lot needs to be done for awareness first, and then acceptance. Acceptance is really lacking, and then we need to work on creating the support system. So yes, Ranjini ma'am, I am with you in this, that the cases are increasing. I do not have the exact reason, but I relate it with the environmental, with the, maybe the chemicals which are infused in our food by way of all those what do you call packaged foods and all. So maybe that is affecting it, or maybe it is. And then a lot of cases nowadays, recently we have seen a new term, virtual autism, because of the COVID period. We have so many children who were deprived of while developmental stage, they did not get proper input in the environment because we learn from the environment. The neural connections which we make in our brain in our early childhood are almost like 3 million per second. So experiences in early childhood are very, very important. The brain doubles the size within first 1 year. By the age of 4 or 5, by the age of 5, it is almost 60%, and by the age of 6, it is almost sorry. By the age of 5, it is almost 70%, and by the age of 6, it is almost 90% of an adult brain. So in that early stage, because children were born who were born in 18, 19, 20, 21, that was the time for them to get the exposure. But they were not able to go out. They were locked in the houses. Parents were working. So parents didn't have that much of time to spend with them. Two-way communication didn't happen. So they could see the screen. They could learn from the screen, but there was no one to answer their queries. A child of 3 years usually asks us not less than 100 questions in a day. So the inquisitivity they have, the questions from those answers, they build up their connections, their brain neural connections, but they didn't get those answers. So probably this is environmental, which I can relate with. Yes.
Thank you. Thank you.
Thank you, ma'am. Thank you for participating. Good to see you here. Yeah. I'll just take quick 30 seconds break. I just need to take medicine. Just give me 30 seconds. I'm back. Sorry, I hope I didn't take 30 seconds also, but yes. Okay, any more questions we have? Okay, we have Shaista from Saudi thanking us. We have Shalini, okay, and then we have Mrs. Sheikh. Okay. Mrs. Sheikh is giving us an advice that parents to make visual schedule. It will help a lot. Of course, I'm with you in this. Visual schedules for children with autism, it helps. It helps a lot, especially when children are not very verbal communicators. Okay, Muhammad Ahmad Malik from Pakistan. Yes, Muhammad, I can relate with you. You have been attending a lot of webinars. We know, okay. And then we have Logan Ashwini. Thank you. Shalini says, could you share any information about special needs education? Shalini, special needs education, what exact information do you want?
Hello, sir. In fact, I'm doing, I'm working on a dissertation,
Uh-huh.
and I'm a teacher. I'm a teacher, but I also have a son on the spectrum.
Mm-hmm.
But I mean, he goes to a special needs school. So I just wondered whether you could like share some links, like, you know,
Sure.
readings or things.
Sure. I can share
Research.
that, and
Yeah.
we can also plan a session on our panel. We have
Yes.
Dr. Gayatri Pisena. She is a special educator with 27 years experience, PhD into special education,
Yeah,
and
that
we
would be
can invite
great.
her and we can have a session on the academics, basically. Okay.
That
Sure.
would be great. Thank you
We
so
can.
much.
We'll do that. Sure. Okay. Galaxy A50, somebody is saying, hello, doctor. Could you please elaborate on what to do during a meltdown? Do not do anything during a meltdown. Just stay calm. Stay calm, relax, and observe why meltdown has come. Let the child take his own time to recover. At the most, you can, relieve the child by giving a hug or by settling. Do not give much of auditory input at that time. Don't give any commands. Don't say, don't shout, calm down. Don't scream. Do not say those words. More input will increase the meltdown. So I've noticed my kid is sensitive to loud noise and loud people. I guess that I should avoid exposing her to such situations. When children are sensitive to loud noise, yeah. So when children are sensitive to loud noise, what we can do is we can slowly expose them to the loud noise environment, but start from home. Start giving, like, while they are playing at home, while they are in good mood, give some auditory input from the background, a little music, little, and slowly increase. So their hypersensitivity with time they will it will adjust. So you need to give that. Whenever you are exposing them at the initial phases, till the time they adjust with hypersensitivity, you give them the earplugs or the earphones without music. I'm just the earplugs which we get in while traveling by flight. So those earplugs that will reduce the noise, or noise cancellation devices are there. Headphones are there, noise cancellation. So you can give them the noise cancellation headphones whenever you are exposing them to the loud noise environment. That is only at the initial level. Slowly, we will take it off by way of making them, they're working on their hypersensitivity into auditory system. In Mauritius, acceptance is a real issue. Yes, Shalini, it is a real issue. I also understand. After acceptance, there are other challenges. Parents usually both are working and they are not able to give time to the child. They are not able to work with the child. That is also a challenge. I am also practically facing it when I'm consulting some of the parents and giving them some activities and some things to do. So it is difficult to them. But yes, we are here. Brenda is there to support and she is creating awareness. So definitely with time it will change. Okay, any more questions? Anyone?
Yes, so I have a difficult question. As advocates or professionals, how do we handle, situations where both parents do not agree on how to, deal with the child's autism? For example, let's say the mother wants to potty train the child, but the father finds it easier to let the child be in diapers. Or one parent finds it easier to give a phone to the child so the child does not run around or goes outside, etc. So how do we approach such a situation, sir?
Okay.
For example, I have one mom complaining. So how do I deal with that?
Yes. So I have a question to you before answering this question. We did a small exercise of counting 0 to 10 before starting the session. Why did we do that?
To reflect.
Yeah, so to visualize and to bring the real challenges of behavior in front of us. We know that we are struggling with our children. That is the reason you all are spending your time and you are here at this late hour with us. But to refresh that memory and bring it in front from the backside to bring in front of our eyes so that we can connect with the session better. So we did visualization. Similar visualization we need to give to parent. You're fine a child doing potty in the diaper right now. When a child becomes 7 years, 10 years, 12 years, or an adult, will you still be fine him doing potty in the diaper? We need to make them visualize the situation and relate with it. Then only they can. If you have some examples which you can give them, which, like maybe some sort of videos or the real children with whom you can connect, they can see if that is possible. So modeling is the best way. They can see, okay, this child was not potty trained at early years until the age of 12. He is now doing potty in diaper, which is a very difficult situation for the child, and his learning is affected because he's not able to move around, he's not able to do things, and it's very difficult for him. It's also so like that. You can do modeling or visualization. Let them visualize. You need to connect with the parent. Do not directly go in, argument with them. Always, whenever we want to connect with someone, we need to go in affirmation with them. Yes, you are right. It is easy. It's the easy thing. Yes, it's a good strategy. Let him do potty in this. I have no problems. It is good. And it is easy for me also as a therapist or as a support staff or as a teacher. It is good for me. All the children should wear a diaper and come to the school and go back in the diaper. It's the easiest thing for us, right? But what are the implications of it in a longer run? Diapers are not very healthy also. They may develop these skin sensitivities and rashes and other conditions. And in a longer duration, child will not learn, child will not be potty trained. It will have its own implications. So we need to make them realize this, but by connecting with them. Most of the time we fail in counseling because we don't connect, we correct. Even with the children also. We try to correct them and they become more rigid. So you try to correct parent, they will say, no, I have more experience. I know it better. It is my child. How do you know it? So you don't correct them. You first connect with them and then let them feel it, let them realize it by visualization or by modeling. Either of the technique. Modeling is the easiest way, but if modeling is not practically possible, then visualization. Let them visualize after 10 years. How do you see yourself? How do you see your child? But not in the first session, not in the first time when you are meeting. First time, it is all affirmation. It's all, yes, you are right. I agree with you. Okay, let us do this strategy. Let us try to continue with what you are doing. Then the parent will have more confidence on you. In the second meeting, third meeting, you can work on the visualization. Okay. Okay.
Thank you.
Thank you. Any other question? Anyone? All right. If we have no more questions, we can end this session here for today. Remember me, Dr. Alok Arora, and my team, JKP Care Foundation. We all are with you in this journey. Don't feel alone. If you have any challenge, anytime, feel free to connect with us. My number is shared in PPT. Tomorrow you all will be getting this PPT. So we are here to support. Wish you all the best. Let us travel this journey together. And I'll work on that with Brenda. We will discuss and we'll work on creating a WhatsApp group for all of you who have participated today so that we can discuss more, we can connect more, and we can plan more such workshops. Thank you. Thank you, everyone. Thank you, Brenda.
Thank you very much.
Thank you.
Thank you.
Good night.